Okay, everyone. Hello, good evening. So today I'm gonna talk about burn injury due to faulty shockwave device in a tendinopathy patients. Actually, just before we just go and trying to explain this lecture, I just want to give you a very simple information, which is the shockwave device actually uses on chronic tendinopathy patients. Okay, so what is the scenario actually? Here we will get a case, and we will talk about the case, and the case will describe that the doctor or the therapist did a mistake on the patient. So, what should the doctor do, and how he should deal with it? How he should deal with the problem he made actually. Okay, we are in group 11, case number 4. Let's get started. Here is the case description. Okay, let's just read it and understand it well. Here we got a 42-year-old male patient was referred to the physiotherapy clinic for a treatment. Okay, so the patients come to the physiotherapy for treatment of chronic patellar tendinopathy. And after that, he was scheduled for the session of radial shockwave therapy using a PTL 6000 SWT device. Okay, so it's very clear now. The patient come to the physiotherapy, he wants to take a treatment of chronic patellar tendinopathy, and the therapist used the radial shockwave therapy on this patient. Okay, so during this session, the patient reported an unusual sensation on the heat at the site of application. So the patient just told the therapist that there's an abnormal sensation, there's an abnormal heat on this application. And the therapist didn't listen to him, or the therapist just said, "Oh, it's just a normal reaction, and it happens with this device, so it's all good. Just don't worry." The therapist tried to let the patient calm. After completing this session, the patient developed localized second-degree burns characterized by erythema, blistering, and tenderness. So after that, they saw that the patient developed a second-degree burns. Further investigation revealed that the applicator head had overheated due to a malfunction in the internal cooling system of the device. So here's the problem actually. Here, the therapist actually didn't check this device. They didn't pay attention, and they didn't pay attention for when the patient reported an unusual sensation, and they assumed that it's just a normal sensation. It's normal because of this device, but it's not actually. It's just let the patient develop a localized second degree. So, the root cause of the incident was identified as a lack of proper preventive maintenance, which allowed the malfunction to go undetected. Okay, so it's very clear. Let me just repeat it real quick. The patient just went to the physiotherapy. He just want to take a treatment of a chronic patellar tendinopathy, and the device was using on this patient to treat him was the radial shockwave therapy. Okay, so after that, the patient realized that there is something abnormal happening to him. This thing was an abnormal sensation of the heat at the site of application. He just told the therapist, "I feel there is abnormal sensation here, abnormal heat," and the therapist didn't take it or didn't take care of it, or they just assumed it's a normal reaction. After that, they saw that there's a developing of the second degree burn, and the cause was identified as a lack of proper preventive maintenance, which allowed the malfunction to go undetected. Okay, so after that, we will go to the analysis. What is the analysis of the case we just described? Actually, the mistaken assumption of the therapist is very clear, as you can see here. The patient reported an unusual sensation and assumed that was a normal reaction, and it's not a normal reaction. The overheating of the applicator caused localized second degree. We just said that. And the malfunction in the internal cooling system of the device. Okay, the malfunction of the internal, actually what caused it caused the second degree thermal burns, redness and blisters and pain to the patient. And the last thing actually is lack of proper preventive maintenance.
I'll explain a quality improvement method called Ask Me 3 and how we use it to analyze a real incident involving a patient injury due to a faulty medical equipment. Okay. The Ask Me 3 method is a communication tool that helps patients understand their condition and what they need to do. It focused on three simple but powerful questions. First, what is my main problem? The patient developed a second degree burn after a session of shockwave therapy. The device used had an overheated applicator head, which burned the patient's skin. The root cause was a malfunction in the internal cooling system, which failed to regulate the device temperature. Unfortunately, the device had not undergone a preventive maintenance, and the malfunction went unnoticed. Okay, the second. Second, what do I need to do? The patient must receive a proper parent care, monitoring the wound for signs of infection, and avoid use a faulty machine again. The incidents also need to be reported to the clinic so the equipment can be removed and inspected. Third, why it's important for me to do this? Proper treatment reduces the risk of infections, speed up the healing, and help prevent permanent scarring. Also, reporting the issue is essential to protect other patients from being injured by the same device and same thing. Okay, next. Recommendation. From this case, we learned some important lessons and we have several recommendations. Number one, the patient should receive immediate wound care. That includes cooling the area with water, applying sterile dressing, and manage any pain or swelling. Number two, the incident must be reported immediately. The device should be taken out of service until it's fully checked and fixed. Number three, the patient should be referred to a burn specialist to ensure proper follow-up and recovery. Number four, all therapeutic equipment need to routine maintenance and safety check. This kind of preventive maintenance help detect hidden problem before they can cause any harm. Okay, number five, staff training is crucial. Therapists should be taught to be listen to the patient feedback during the session. In this case, the patient might have experienced discomfort before the burn occurs. If the therapist take those early complaints from the patient seriously, the injury could have been avoided. Okay. Conclusion. In conclusion, in this case, the case show importance of the device safety, preventance, maintenance, and clinical awareness. The patient injury was preventable if the equipment had been regularly inspected and staff had been responded quickly to the sign of the discomforts. The pain would never have been happened. Okay. This highlights how the tools like Ask Me 3 can help us break down the complex incident and develop a clear response plan. Improving patient safety isn't just about technology. It's about people, communication, and responsibility. References. This is our reference, and this is the reference we used in this presentation, including a case report from Stars Medical, FDA Safety Communication on Medical Devices, CDC guidelines for the burn injury care, and Mayo Clinic clinical instruction on treating second-degree burns. Okay, that was our presentation. Thank you for listening. I hope this case helped us demonstrate how communication and equipment maintenance and quick clinical action can work together to protect the patient's health and improve the quality of the care. Thank you.